Joining us now, Dr. Peter Hotez, Dean of the National School of Tropical Medicine at Baylor College of Medicine and co-director of the Texas Children's Hospital Center for Vaccine Development. He is author of the book, Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. And certainly want to ask you about those who are concerned about the vaccine and vaccine hesitancy in just a moment. But first, given the science, and I'm really just sort of emotionally, viscerally responding to the pictures we just showed of spring breakers all crowded together, using each other's phones and totally breathing all over each other. I mean, is this what is supposed to be happening right now if you don't have a vaccine? I know there are guidelines out there. There are different states and different communities saying you can do this, you can do that. And there's a lot of sort of middle ground, misunderstanding about what one should be doing. But what should one be doing right now if they don't have the vaccine? Should they be social distancing 6 feet apart and not going out?
You know, Miko, we were spiking the ball on the 20-yard line. We haven't even turned the corner on this epidemic yet. The numbers are not even plateauing anymore. They're going up. They've gone from about 55,000 new cases a day to 60,000 new cases a day. We're seeing sharp increases in the Northeast, New Jersey, New York, Massachusetts, Connecticut, and those are the states we're actually overperforming on vaccinations compared to the rest of the country. So we've only vaccinated about 28% of the U.S. population's only gotten a single dose. Big spikes in the Northeast, big spike in Michigan now, and we're about to go on to our fourth wave unless we can figure out a way to tamp this down. And, you know, as was pointed out by the others, this is not in perpetuity. We are going to vaccinate our way out of this epidemic starting in the summer, but not until the summer. Yeah. We have another 6 weeks, and these numbers really are going to start to go up.
I feel like, Ed Luce, this is almost a political problem, because if the president and his CDC puts out very strict social distancing guidelines and really pulls back, I think there's going to be a wave of anger from a code of conduct and a way of life that was pushed by the Trump administration, who promised that everything would be back to normal by last Easter, and it would be like a miracle.
Yeah, I think there's an expectations management problem here. I mean, we are all expecting a return to normality quickly, and it might in fact take years for a pre-pandemic lifestyle that we're yearning to go back to become an actual reality. But I wanted to ask the doctor, the idea that all children should be vaccinated before schools can get back to normal is something I've heard circulating recently, and some of the teachers' unions have been raising this, which potentially would put in jeopardy a normal school year beginning even next September. Is that too pessimistic? And if it isn't, is it possible to get all the trials for children done in time so that we can have a normal school year?
Well, I think things are going to be a lot easier starting in the fall than they've been for the last year, and a couple of reasons. First of all, I think teachers and staff will be fully vaccinated, and the parents by the fall. I think we'll probably have the data to start vaccinating adolescents so that junior high schools, middle schools, high schools could have pretty much everybody fully vaccinated by the fall. I think that's within the realm of possibility. I doubt we're going to have the data for the little kids yet to support vaccinating younger kids. So we'll still have a bit of a rocky road in the elementary schools by 2022. Next year, I think we'll vaccinate the younger kids. But no question, things are going to be so much better for the fall school year. So I think, yes, we can have a good fall school year, but we've got a dramatically lower transmission in this country. And with that B.1.1.7 variant that is more transmissible, and which is going to be the dominant variant in the U.S. for the foreseeable future, and the fact that it's higher lethality, higher morbidity and hospitalizations, and it's affecting younger groups now. We're starting to see in the upper Midwest now a lot of young adults going into hospitals and ICUs. So we've got to get that under control. Until we do that, we really can't even talk about much of anything.
Jeez. Jonathan Lemire.
Doctor, thank you, Mika. Doctor, I wanted to follow up on that point, the demographics of the people who are getting sick right now. If you could tell us a little bit more about, who is getting ill. We certainly know that the vaccines have had the highest penetration to seniors, and they're older Americans are fully vaccinated now, and more of them, and can able to return to their normal lives. Are we seeing that it's younger people getting sick? And then connected to that, what is the latest research on the idea of a booster shot? And I know that seems like it's far away. So many Americans haven't even gotten one dose yet. But the idea that will another dose be needed, whether it by year's end or next year, is this going to be a seasonal thing that Americans are always going to need COVID-19 vaccinations?
Yeah, so a few things to unpack there. I think we are seeing a younger age groups going into hospitals now. Not a lot of hard data on it, but certainly a lot of anecdotal data, especially in the upper Midwest, younger adults getting sick. And that was more or less predicted from the UK when we saw the B117 variant really rise up in last September through October, November, December last year. Now we're starting to see something similar in the US. And that was the reason why I did everything I could to try to encourage people not to participate in spring break, because down in Florida and here in Texas, the B117 variant is overwhelmingly the dominant variant now, and now we're just spreading it all over the country. So we're in a race now to vaccinate. In terms of booster shots, I think that's probably likely. So if you got a 2-dose Pfizer Moderna vaccine, think of it as a 3-dose vaccine now, because you're going to need a booster either later this year or next year. Same with the Johnson & Johnson vaccine. Think of it as a 2-dose vaccine later this year, and that'll do or next year, and that'll do a couple of things. One, it'll increase your level of virus neutralizing antibodies and create better durability, longer lasting protection, and it'll likely be reconfigured a bit to look after the South African and Brazil variants. So all of the vaccines work really well against the B117 variant in the UK. So we're not worried about that. But there are other variants of concern out there from South Africa and Brazil that will become more important players later on in the year and next year. And so that's the reason for the boost. I don't think we're going to need an annual booster like flu. I'm hoping that with that one extra booster, we might be done with it. Of course, we don't know for certain. We're not doing anything to get this pandemic under control in Africa and Latin America. There's basically no one's getting vaccinated in Africa for all practical purposes. Practically no one's getting vaccinated in Latin America. And so when we let that pandemic get out of control, we know what happens. So that's a big unknown.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.